Let's talk health now. Malaria remains a major infectious disease concern in Nigeria with an estimated 65.4 million cases and 193,512 deaths in 2021. The country has also estimated 1.8 million people living with HIV. Another infectious disease, Lassa fever, has continued to affect thousands annually in Nigeria. In 2024, more than 1,000 confirmed cases reported across 28 states, and there have been several discussions about prevention and management of these diseases. World Health Organization says it continues to intensify its support to the Nigerian government as the Nigerian Center for Disease Control and state governments strengthen preparedness and response. And I'm joined by public health physician and infectious disease specialist, Dr. Godson Ondubueze. Thank you for joining us at this time. How would you assess Nigeria's healthcare system in the area of, preventing these infectious diseases and effectively responding to re-emerging threats?
Well, thank you so much for asking that. I would say largely Nigeria has come a long way in the health system. And for the over course of 10 years, we've seen some progress in infectious diseases, specifically in Nigeria. Currently, Nigeria still, ranks globally as the #1 country with highest number of infection in the sub-Saharan space. And, the national prevalence is at 1.3. That means almost 2 people tested in 100 people have HIV. And you could even see some states have as high as 3 and as high as 5. But even in the light of all of this, there's been some cutting, there's some funding cut from the international agencies and the donor agencies in Nigeria. And this was almost when we got about $2.8 billion attributed to the health sector. And this bulk of this came through for HIV, malaria, TB, and even polio. But then in 2023, it came down to about $600 million in health assistance. And there are too many implementing leading partners in this space, the FHI, the Achieving Health Nigeria Initiative, EQs, Project Hope, and the rest of them. More so, even NACA and NASCAP and the Ministry of Health have built remarkable infrastructure that has helped with the progress. We've seen some notable advancement, like I mentioned, and the declines have, decreased for about 21% in, between 2010 and 2019. But then, of course, this problem of financial uncertainty is, bringing some strenuous challenges to this space. And even with recent U.S. governments who are looking at cutting down their expenses on international health matters.
Dr. Godson, this is a real concern, cutting down on some of the funds that have been given by the United States, a big issue. But let's talk about some of the high-risk states, ensuring that the interventions or what we have in place right now is targeted towards those priority states like Benue, which was one of the highest hit. 64 confirmed cases of Lassa fever, and that was even in 2024. That state right now is also experiencing a security, threat. How do we ensure that proper healthcare continues to reach this state?
Yes, I'm glad you actually mentioned Benue State, because even at the time, too, in addition to Lassa fever and HIV, Akwa Ibom also is another challenge that is there. But one of the things that we should actually, the top priorities for policymakers and partners is to, we need to be precise with building with sustainability in mind. And there must be also, that's #1. One of those programs that brought about sustainability and ownership was when the Nigerian Ministry of Health initiated the landmark clinical mentorship program that was supported by the CDC. Amazing platform. But building such sustainability and ownership should be what we should look at designing programs. And then secondly, also is looking into how we could even impute digital platforms like what we are currently doing at Prescriber, which broadens access to medications. There's also a need for biomedical innovation where we get to, look at what are the current medications that we could use as prophylaxis in these cases. And of course, looking at PrEP and looking at some other medications that we could look at as interventions. There's also a need to diversify funds in this space to encourage the health system and building resilient structures within the primary healthcare centers.
Right. Dr. Godson Ondubu is a public health physician, infectious disease specialist. Thank you for talking to us at this time.
Thank you so much. Thank you for having me.
I'm still talking health.